Rescuers in Beirut are searching for survivors after two explosions left much of the city in ruins. Well, the blast happened at a warehouse where tons of a highly explosive chemical were stored, apparently without any safety measures in place. At least 100 people were killed and thousands injured. Authorities have placed a number of Beirut port officials under house arrest. The government has now declared a 2-week state of emergency for the city.
The sun casts an eerie glow over Beirut's obliterated port. Once a vital artery for imports and home to the country's wheat and grain stores, it's now a sea of metal and concrete. Lebanon is a nation in mourning, among them the staff at this nearby hospital. There are a lot of victims. We lost 4 nurses and patients, visitors, many dead and many injured. We have like 200 injured. It was a sleepless night at the rest of the city's hospitals. Overwhelmed doctors treated the injured in hallways. Vital supplies are running low. Outside, agonised families waited for news of their loved ones. Many remain unaccounted for. He is 29 years old. From 7 p.m. in the evening, we have been all over every hospital in Beirut, and now we're waiting for the names to come out, and nothing has come out. We do not know if he is dead or alive. We do not know. Questions too as to how thousands of tons of highly explosive fertiliser, ammonium nitrate, ignited, sending shockwaves across the capital. The blast was heard hundreds of kilometres away in Cyprus. Political leaders called for unity while visiting what remains of the port. Even for a people accustomed to horror, the aftermath is unprecedented. After this catastrophe, we have to stay strong. We have to stay calm, but this is too much for a nation. A massive clean-up is slowly underway, but officials say the rebuild could take years. 300,000 people have been left homeless. The Prime Minister has declared a 2-week state of emergency and called on the international community to provide humanitarian assistance.
And we can take you to Beirut now because shortly after the blast, the capital's hospital reached full capacity. Let's find out how they are doing right now. We're joined now by Raymond Tarabay. He is a partner coordinator for the aid organization Malteser International. Sir, good to have you here on the show. Is your facility operating at full capacity right now?
Greetings from Beirut first, from an almost entirely destroyed downtown of the city. Actually, we were trying to offer in our primary healthcare centers emergency and first aid due to the explosions in the center where 4 of the 5 Lebanese hospitals were destroyed, some of them entirely, that they became dysfunctional. There was a huge load on the other hospitals in the area. So all primary healthcare centers were asked to open the doors for injured people, and that's what we did. We took over parts of the slightly wounded. For sure, a primary healthcare center cannot offer full-fledged tertiary medicine. So we took dozens of injured people to our primary healthcare center and treated them with first aid and stuff like this.
And what do you do with patients who come in who require, who are in a critical situation and require more medical treatment than you can offer?
We tried several times to transfer them to nearby hospitals or even far away hospitals that are in the vicinity of 10, 20, 30 kilometers. All hospitals, almost all hospitals of Lebanon were working yesterday to receiving patients from downtown Beirut. And when you have severe cases, you try to get them a place, an operations room, an emergency room, or whatever was needed in that situation.
And what are the cases that you are getting? What type of injuries are you seeing?
We have seen a lot of, people injured with glass, wounds, cut wounds, a lot of burnt syndromes, and stuff like this. It was we received people with broken legs, broken arms, and we've seen a lot of various injuries. If you have seen the blast yesterday, I think this gives you an idea about how enormous and strong the explosion was and how many people were really affected.
Now, of course, a lot of people from the international community are sending teams over to provide and help also with medical assistance. What would you need? What would you like them to send over?
I think as a first response, the medical situation was kind of, coped with. What we would actually need, and the country would need, the people would need much more in the coming future, is shelter aid, pure humanitarian aid, food assistance, basic assistance, anything that can help people. I mean, we have heard more than 200,000 people are homeless now. So we need shelter, we need homes, we need people to open their houses, and international donors to contribute to this catastrophe that had happened yesterday.
All right, Raymond Terabey from Malteser International. Sir, we wish you, your team, and the people of Beirut all the best.
Thank you.
And earlier, DW News had the opportunity to speak to Dr. Asim El-Hajj, a medical director at Clemenceau Medical Center in Beirut, and we asked him how hospitals in the city have been coping.
It's kind of very unexpected situation. We're trying our best to keep up with coronavirus standards and precautions and dealing with the mass casualties coming to our hospitals. It's been the story the same in most of the big Beirut hospitals. So in our situation, we had to dedicate people to provide injured people and their family and friends with masks in the emergency room. Our staff were all protected with different types of masks, N95 or regular masks, and hoping this wouldn't increase, effect of corona. So we have more injuries in that sense.
So many compounding factors that Lebanon has to deal with. Dr. Asim El-Hajj speaking to us from Clemenceau Medical Center in Beirut. Well, with me here in the studio now is my colleague Emel Deeb from our DW Arabic desk. So good to have you with us here, Emel. I cannot imagine, you are Lebanese, the anxiety that you must have been experiencing. First of all, how are your relatives? How are your loved ones? How is everybody back home?
Thank God everybody I know is fine and safe and survived the blast. Luckily, my parents live in North Lebanon and not in Beirut, and they were able to survive this. But it has been a very, very tough 24 hours. For me and everyone who lives abroad, we're all worried about our loved ones. There's still search and rescue operations ongoing to find those who are still missing. It's been a very, very tough time, and the least I can say is that we're all traumatized from that, despite having lived several wars and several catastrophes in Lebanon. This seems to be on a just different level.
What are your friends, what is your family telling you the day after?
They're still in shock, that's for sure. Everyone is still in shock. I hear different stories from friends and family members who rushed to Beirut to help today. One of them is actually my brother. He went to Beirut today to help in the rescue efforts. People are still not really aware of what just happened. They're still trying to search through the rubbles for their belongings, for their loved ones, for the lives they've lost.
And talk to us, the blast happened at the port. How central is that? Just give us a sense of the location and the reverberations of these explosions for the people who are living there.
Yes, I mean, definitely a lot of analysts are saying it's a good thing, I mean, that the explosion happened at the port because half of the magnitude of the actual blast went into the sea and not into the city. You know, like there's a circle of when a blast happens, so only half of the blast affected the city. Imagine if this would have been in a central area, the whole city would have been even much more damaged. Beirut's port is the only port in almost in Lebanon, and it's the one that receives and stores all the imports that come in terms of food and medical supplies. We've seen we are going to see a lot of shortage in the coming few days if there's no proper aid is provided. There have been news also about the destruction in a nearby warehouse where medication, specific ones for serious conditions, were completely damaged. So it's a very serious situation at the moment. There hasn't been yet a clear idea about the damage, the real damage. Beirut's mayor is estimating $3 billion to $5 billion in damages in the city, and almost 300,000 people slept outside of their homes last night. So we're talking about 1/4 of Beirut's residents are homeless as of yesterday.
1/4, I just want to stress that again, out without a home or a roof above their heads. What is most needed right now for the people of Beirut?
Support, help, medical assistance. That's the most urgent thing at the moment as hospitals are collapsing. They were already struggling with COVID-19 pandemic, and they were really struggling to find the proper medical supplies. A lot of countries have offered to help. A lot of countries, namely European ones also. French Macron is due to fly tomorrow to Beirut to meet with political leaders and assess the situation. Helicopters full of aid and medical supplies are reaching Beirut's airport at the moment, providing groups of aid workers or health workers, but also food and supply. Lebanon needs food because there's a real hunger crisis that is due to happen. Lebanon was already dealing with such a big economic crisis, and now it's even more serious than that, but also medical supplies. That's what Lebanon needs at the moment.
And of course, Lebanon is also hosting a lot of refugees as well, so it's all around a very precarious situation. I mean, rest assured, our thoughts go out with the people of Lebanon. We wish you all the best in these very, very trying times. Emma Diba from our Arabic desk. Thank you.